Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, the Member Engagement and Communications Manager at GIG Gulf Insurance. It's that time of the year where everyone has a little bit of the sniffles or a cold. Seasonal changes can be a bit aggressive in how they affect our health. But in this episode, we'll tell you what you can do to boost your immunity and safeguard yourself against the flu and other infections. Joining us today is Dr. Marilyn Karam, consultant allergist and clinical immunologist from Saudi German Hospital with more than 10 years of experience. She's also very deeply committed to medical education, which is evident in her imparting knowledge to medical students and residents. She's also passionate about medical research, and she's dedicated to advancing medicine and improving patient care. Thank you, Dr. Marilyn, for being with us today.
Thank you, Yasmin. It's good to be here.
So I know it's a bit of a basic question, but let's start by explaining to our audience, what is immunity?
Okay, so immunity is basically, let's say, an army that we have inside our body that will defend us against all the different invaders, which could be bacteria, viruses, or fungi, anything that's not supposed to be there. And there's really two different types of immunity. So there is something we call innate immunity, which is non-specific and immediate response that occurs immediately. And this type of immunity does not really learn from past exposure or experience. And then you have the adaptive immunity, which is important. It's slower in onset, but it's very specific to the pathogen involved. So this is the basis of the vaccines, how vaccines works by remembering past infections.
Okay, can you tell us what are some of the factors that can weaken our immunity?
So obviously having unhealthy habits like eating poor diet, not sleeping, not exercising, stress can all lead to different tolls on your immune system.
Is there like a threshold? Like when do you say if someone has a weak immunity or a strong immunity or just average?
This is a difficult question because it's not really straightforward. Measuring immunity is not really straightforward, but on average, getting sick 2 to 3 times per year is normal for most people.
Okay, you mentioned some lifestyle changes that can, or lifestyle habits that can affect our immunity. Can you tell us what are some of the good lifestyle habits?
Yes, so for example, a balanced and healthy diet rich in fruits, fibers, whole grains, that can also help. Exercising regularly, as I said, sleeping, and obviously, if you can reduce the stress, that is very also important.
Would you say there are some supplements or vitamins that you usually recommend to your patients or that can help with immunity?
So we don't have really strong data. We know that sometimes vitamin D, vitamin C, and zinc are prescribed to boost the immunity. But is, again, a balanced diet and getting these requirements from your diet would be more beneficial. So it's very important that the patient does not just go to the shop and starts getting supplements off the shelf and start taking supplements, because not all of them are actually beneficial.
Yeah, but with Dr. Google now and all the social media posts and everything, there's a lot of content about you should take this and this and this to boost your immunity, or if you don't have a good immunity, then you should take, I don't know, it's usually a combination of stuff.
Absolutely, and Dr. Google is a double-edged sword. This is
So
what I
true.
call him, actually. So Dr. Google. It's good to be informed, but also it's good to filter through all the data out there. And supplements in general can be okay and can be good, but your requirements can be totally different than my requirements, depending on your age, your ethnicity, your background, like your race. Even hormonal changes in our body can basically affect the way we respond to these supplements. So each different would require different supplements. So it's important to discuss this with your physician before just embarking on your backup supplements.
No, I think especially vitamin C, everybody sort of takes that as juice because actually they have those effervescent tablets and it tastes good. So, and I think at some point, whenever you'd make an order from certain pharmacies, you would get like a free vitamin C, the tablets.
Yeah.
And I think this is when vitamin C just, I had a lot of it at my home because every time I just order some painkillers or something, I get vitamin C with it.
That's actually one of the myths. So vitamin C actually is helpful. I'm not saying that it's not helpful, but what I'm saying is that anything in excess is not useful. And as long as you have a balanced diet, so you're getting your requirements from a healthy diet, then you really don't need to supplement excessively unless you do have a deficiency somewhere.
Yeah, and I think some of those vitamins and some of the minerals as well, they have like negative side effects if you take them in excess.
Oh, absolutely. You can have vitamin D intoxication. Vitamin D intoxication, that's a whole thing in medicine with a condition, and then it can seriously affect your health, and you may end up in the hospital being treated for that. So.
Yeah, can we elaborate a bit on that? Because everybody is like, yeah, you live in the UAE, then you need vitamin D because we're not getting it enough from direct sunlight. So.
Okay, so vitamin D is actually very good for a lot of different things, especially in my specialty for allergies and for immunology. It actually will boost your immune system. And the opposite of what people think, being in the sun or bathing in the sun all day long is sometimes not enough for you to have a good vitamin D level. The amount of vitamin D that our skin produces differ depending on genetics. So we know that people living in the Mediterranean area do not form so much vitamin D compared to other places. Age as well. So the skin, as you age, will produce less. So this is where you really need to have the discussion of, depending on your age, depending on your requirements, depending on the vitamin D level, and then you can decide with your doctor how much you need. So whether it's like 1,000 a day, 10,000 a week, 50,000 a week. So it really depends.
Yeah, because vitamin D has been linked with a lot of other conditions. So even people who are having trouble with weight loss, then they would say maybe you have a vitamin D deficiency.
I'll tell you why from the immunology perspective. So from my perspective, vitamin D helps to have an anti-inflammatory milieu in our system. So it helps, this is how it helps to boost your immune system. It targets something we call T regulatory cells, and it helps them to be the anti-inflammatory soldiers, if you want. So this is how it actually works. So yes, it can help in different aspects because the immune system is really involved in a lot of different conditions, and it's at the basis of, asthma, PCOS, all the other different conditions. So there is a role maybe, but do we have strong data to support that? No, we don't. We know that vitamin D deficiency, for example, will give you myalgias, meaning muscle pains. It can easily also affect your mood. Some people will have depression. I had a vitamin D level of 5 and I could not understand my mood swings, and I replaced it and I could not believe it from personal experience. But I'm not saying everyone with mood swings go start your vitamin D. So really, again, you really need to talk to your doctor and decide on how much you need and if you need any supplementations.
Yeah, we always say that, before you just start taking any vitamins or supplements or anything, just do a checkup. Go to your doctor, see what's happening with your body before you just make random decisions about, I need vitamin D or vitamin C or any other vitamin.
Absolutely, absolutely.
Yeah. You mentioned that immunity is involved with a lot of other conditions, and I, for one, never knew that. I always thought it's just infections or like bacteria or viruses. Can you talk to us more about what other conditions can be caused by a lack of immunity?
It's not so much a lack or, if you want, a malfunction in the immunity. So all the autoimmune diseases, for example, you can have thyroid disease. So you can have autoimmune thyroid disease where your own body attacks the thyroid and then it doesn't work anymore. You can have diabetes. There are certain types of diabetes. Type 1 is also an autoimmune disease linked to immunity, for example. Asthma, allergies. I can go on and on and on. Really, there's always some involvement of the immune system because it's so complex and it is at the basis of how our body works and interacts with the environment and all the chronic or acute diseases.
I think there is a myth, and you can let me know if this is correct or not, that all of the autoimmune diseases are mostly genetic. So some people are just genetically predisposed to getting, as you mentioned, type 1 diabetes or asthma or thyroid issues.
Genetics definitely play a role in increasing your chances of developing an autoimmune disease, but it doesn't mean if one of your parents or relative have an autoimmune disease, you will definitely have it. So it does raises your chances a little bit compared to the general population. And then when you have one autoimmune disease, unfortunately, you are at a risk of developing another autoimmune disease. So let's say you have, thyroid, you may have autoimmune urticaria with it. But it's not that we go and do a full genetic testing and wait for the autoimmune disease to happen. We know that there's certain genetic mutations associated with certain diseases, but again, you can live your whole life with this mutation and never actually develop the disease.
So you're saying there are triggers that then kind of provoke this disease into coming on?
So to put it simply, we may be exactly the same person, let's say, with the exact genetics, maybe different environments. We still don't know why I will develop an autoimmune disease versus you. We may have the same genetic predisposition. However, we talk about genetics, interaction with your environments. Sometimes we don't know really, the plain and simple, we don't know why you or me would develop an autoimmune disease versus not. So we don't know what would be the trigger is basically what I'm saying.
Not yet. I mean,
Not
here's
yet,
to
of
hoping
course.
that somewhere in the near future we do understand, and then we can help
And
help
thank
the
you for
patients.
saying that, because this is really at the basis of my field as an allergist immunologist. This not yet is very important. It's a huge field, and research has played a huge role over the past 10 years. We have done really, now we can move from just generalized medicine to personalized medicine because of what we've learned with the immune system over the last 10 years. So that's where we're heading now.
It's great. That's great news. I mean, I never heard the term personalized medicine before, but I mean, it sounds like a very great approach to like just see what a specific person needs based on their gender, their age, their body requirements, rather than a blanket approach of just take this medicine and you'll be fine.
Yeah, a very, very simple example is asthma. And asthma is, under asthma, there's literally types and types of different asthma. And treating all patients with asthma the same way is definitely the wrong thing of doing. You have allergic asthma, non-allergic asthma, eosinophilic, neutrophilic. There's a lot of different types. And again, it's important to kind of differentiate and make sure what would benefit you the most instead of using the one-size-fits-all approach.
Okay. You mentioned different ages and different ethnicities, and that people with different ages and different ethnicities might have different reactions or to specific triggers or something.
It's not really different reactions. What I meant by saying, so as your age, your immune system kind of just weakens, it gets tired of doing what it's doing.
Makes sense.
And certain ethnicities and races do have certain genetic predispositions. So this is where also that can affect your immune system as well.
So when you recommend an approach for someone to strengthen their immune system, is that approach different from genders or age groups? So for example, if me and my husband, and we both want to improve our immunity, should I be doing something different than him?
I mean, I'm assuming you and your husband are the same age group.
Yes. Yes.
So in general, it should be approximately the same. The difference is that we look for chronic conditions, and obviously if pregnant ladies are a different also category, if you'd like. But there are supplementations, there are vaccines that are safe for both mom and the baby. So to put it simply, it's probably going to be very similar given the age. But if you have different medical backgrounds, so different chronic conditions, then this is where it would differ.
No, I mean, I meant assuming like just the basic people, no chronic conditions, because I know that chronic conditions like hypertension or diabetes, then it's a whole different recipe.
Right, right. Even, allergies or asthma or autoimmune disease or any lung condition or respiratory condition, then you would approach differently, and you would also recommend different vaccinations.
From your experience, do you find that mental well-being, and I mean, I know you mentioned stress, but how much does stress impact our immunity?
Okay, I know that from the patient's perspective, we are fed up hearing the doctor say, oh, this is stress and this is stress. But stress does make everything worse. It is not the cause of everything, but we know that it will affect and weaken your immune system by inducing inflammatory changes and hormonal imbalances in our body. So definitely, I always assume everyone who walks into my clinic has stress. In this, nowadays, you really have just levels of stress. And it's important, to control that before it controls you. Culturally, we always have a reluctancy to seek the help of a psychiatrist or a psychologist or a life coach. And we assume, or we say in Arabic, "Katter khair Allah," basically, right? We have everything. We don't understand why we're stressed. Well, we really don't need to understand. We're stressed, period. Take it as it is and control it before it controls you is what I tell my patients.
Yes, culturally, there is a big stigma with mental health or mental well-being. And it's part of the reason we have this podcast is we're trying to spread awareness that, okay, you know what? Your mental well-being is important.
Yeah.
It is what it is. So you've got to do something about it.
Absolutely. Absolutely. Because at the end of the day, you can't really change the environment you're in. You can only change the way you react to it. And sometimes with the help of someone who has a different insight in your life, they can help give you pointers and just, point things out for you that you never thought of before. So
yeah, it's really helpful when you get like someone who can just look from the outside and see like the big picture.
Yeah.
They're always able to give you more insight than when you're focused in the middle of your life.
Absolutely.
Okay, a question that I'm sure you get so much: the flu vaccine. Should we or should we not take it?
So there is a misconception about the flu vaccine, and I hear a lot actually. I took the flu vaccine last year, doctor, and I was sick all winter. So the flu vaccine really will protect you against certain strain that the scientists will expect for the next season. So sometimes it's a hit or miss. This is why this year this vaccine was great. That year it wasn't. And what the vaccine does, as we talked about adaptive immunity first, so what the vaccine does, it boosts your immune system and kind of introduces it to this virus. And when you get the virus, then your symptoms will be less. It doesn't mean that you're not going to get sick, but the severity of the illness would be less than if you wouldn't take the vaccine. So, I can I can argue with someone who is completely healthy, who doesn't want to take the flu vaccine, fine, maybe. But extremes of ages and chronic conditions and pregnancy will predispose you to severe flu infection. So these are the category of people where it's a categorical yes, they have to take their flu vaccines.
Okay, there's a myth, and you can tell me if this is correct or not, that if you take the flu vaccine once, then you always have to take it.
Not really. I mean, you can choose to take it a year, but with time, the memory of that vaccine will fade. This is why you need to take yearly vaccines, and because the strains change from year to year, that's why also you have to take the vaccine. But you can still choose and decide not to take it next season. So, although I'm saying to take it.
You know, I think the myth came from that if you take the flu vaccine, then somehow your body is not strong enough to fight the flu on its own. So it kind of always needs that support from the vaccine.
Okay, so let's explain what is the flu vaccine, right?
Okay, yes.
Okay, so the flu vaccine is this influenza virus that is killed, okay? So we expose it to our immune system through the vaccination, and then we kind of introduce it to our immune system. And the adaptive immune system will say, hey, hello, how are you? Oh, I know you. And then, so if you're exposed once again to the actual live virus, oh, you're not supposed to be in my body. So the response is quicker. Okay. And we already know which enemy we're dealing with. So we already know the virus, so we're prepared to fight it. So this is how vaccines work. So it's actually useful to be exposed to the infection. This brings me to one other myth that I would like to mention. You know, we get a lot of mothers bringing in their kids, really frustrated about the rate or the frequency of infections in nurseries and schools. And my answer is that the more they get sick when they're younger, the better. And that's because we are strengthening our adaptive immune system. So yes, you get sick initially, but then eventually your immune system will remember and will fight off all these infections more effectively. So
yeah, I guess this is why, like, if someone gets the chicken pox when they're young, then they don't get it again when they're older. And it's always like, it's better to get it when you're young because your children are more resilient and they're able to fight it off. And usually when people get the chicken pox when they're older, the symptoms are so much harder and stronger.
Absolutely.
Okay, great. Okay, this brings me to a tricky question. From your experience, do you see that there are some long-term side effects of the COVID vaccine?
I haven't really, I mean, seeing side effects, long-term side effect from vaccination is extremely rare. From the COVID vaccine specifically, I haven't seen any long-term side effects personally.
Okay, that's great because, and I meant to ask this question because we get a lot of people now who are freaking out about, yeah, because 3-4 years ago I took the COVID vaccine, maybe that's why this and that is happening to me.
See, I think it's because it was a pandemic and the only thing we were focused on is COVID and COVID and COVID. And now everyone knows what an mRNA vaccination is, which already existed before COVID, but we didn't really give, pay attention to it. So again, it's the same concept as the flu vaccine. We were given the dead form of the vaccine that can scientifically cannot cause COVID. So yes, everything has side effects in medicine. I mean, if I tell you anything, even simple paracetamol.
Even Panadol, yes.
Even Panadol will give you side effects if you take it incorrectly. But is it frequent? No, it's not. It's very rare. So.
Okay. Any other myths about immunity that you would like to set straight?
We've talked about a lot, but one other thing I hear a lot is I'm going to detox my immune system and start doing these cleanses and diets and or inject those vitamins and all of those things. So one, your immune system doesn't need to detox. It doesn't work that way. And then, as I said before, it's very important to have a healthy lifestyle and balanced diet and not over binge on supplementations that are not really regulated and indicated, because those as well will have a lot of side effects. So, yeah.
I mean, and then you have only yourself to blame because we told you not to take something without checking with your doctor first. No, because like we said in the beginning, I do think that Dr. Google is a double-edged weapon. Yes, it helps with awareness, and yes, you can get a lot of information in there, but there's also some not very correct information or something that could work for someone but not another person. So it's just always better to check with your doctor.
Absolutely.
Okay, my last question, because we're running out of time. Any tips you would like to give our audience for strengthening their immunity? I know we mentioned lifestyle changes, but there's always like drink honey in the morning and lemon helps with this and all these stuff.
As I said before, really, maintaining a healthy lifestyle is really important. And then I think that the notion of eating honey came with, having a balanced diet. This is why we say you need to, I mean, there's really no hard evidence behind these claims. So there is no research that tells us yes or no. And I'm going to really also add to this is, we have Chinese medicine, we have alternative medicine. It's been there for centuries and it works. But do we know how it works? No, we don't. And the problem is that it's not regulated. So different boxes of the same supplementation or alternative medicine would be completely different. And also, we don't have hard evidence or research on it. So I cannot give you a scientific and evidence-based answer.
Yeah, fair enough. I mean, I think it's always the grandparents who always said, like, no, if you take a teaspoon of honey in the morning, you'll never get sick, blah, blah, blah. There's always, there are a lot of things.
Because it has an anti-inflammatory component. So there is some truth to it, but again, not, so.
Okay, well, I guess the conclusion is if you want to take honey, go ahead, but
it's yummy, so.
Sure. But it's not going to fix all your problems.
No, absolutely. So here's the danger. The danger is that a lot of the times, some patients will not take medications. They don't want to take medications. They don't want to do that. But some conditions where the immune system is really weakened, where you cannot really fight these infections on your own. This is really, these patients are really the ones who actually need medications and need help. So you cannot really solve everything by, diet and supplementations and all of that. So warning signs would be recurrent infections, as we said, more than 3 per year, and having a very poor recovery time or long recovery time from normal infections, and then also having a lot of bacterial infections, so requiring a lot of antibiotics for treatment would be red flags for you to actually come to an immunologist and talk about those things and check your immune system.
I'm glad you mentioned antibiotics because that's also one of the hot topics. Mm-hmm. Where no, don't take antibiotics, even if their doctor prescribed. Mm. So maybe we should shed some light on that.
Yes. So the problem with antibiotics is from both sides, from the patient's side and the doctor's side. The patient comes to the clinic, he's pushing that doctor for some medications. I want to get better super quickly. And I need some medications. And then we're over generous prescribing antibiotics, in my opinion. So having a viral infection, which does not need antibiotics, will need 3 to 4 days for you to recover, for the fever to go down, and for everything to just, pass. And then by the time you actually start the antibiotic, oh, I started yesterday, I'm better today. Well, no, you're better because your
Because it
infection
ran
is
its
wearing off.
course.
Yes, exactly. And so your antibiotics needs at least 48 hours to work. So it's not like a magic pill. And the problem of taking too much antibiotics is that, and not completing the course, not just taking too many antibiotics, is that the bacteria that we're trying to kill kind of get used to it, and you have bacterial resistance. So it's really important to take antibiotics only when indicated, not just at the first sign of fever, start your antibiotics. Wait at least 48 hours to 72 hours until your fever effervesces or passes. If it doesn't, then okay, fine. You need the antibiotics and take them.
I think a very common scenario is someone gets the flu, they start their medication, and then they start the antibiotics, they start getting better, they stop the antibiotics, they don't even complete the course, and then soon after they get sick again, and then they just have some leftover antibiotics from the first time, so they just take it again.
Or from the neighbor or the friend.
Yes, yes.
So yes, that's really the worst thing to do, honestly, not completing your course and then just, self-prescribing antibiotics. Because when the time comes that you actually need that antibiotic, it won't work because you've been exposed to it so many different times, and this bacteria kind of just now knows what's coming, and then it creates resistance, and it's not killed by this antibiotics. This is why you end up in the hospital, because you need IV antibiotics instead of being at home with oral antibiotics.
Okay, thank you. That was very informative. It was great having you with us.
Thank you, Yasmin. Thank you.
Thank you. Our next episode is one specifically for the ladies. We're discussing PCOS. If I were you, I wouldn't miss it. You can find us on YouTube, YouTube Music, Spotify, Apple Podcasts, Anghami, and Amazon Music. Stay well and keep thriving.